Welcome to Prenatal Health. Today we are going to be talking about yeast infections. Yeast infections are the second leading cause of vaginitis in women. This is commonly caused by a fungus called Candida, which is naturally occurring in the vagina, the oral, the mouth, and the digestive tract of both men and women. It's natural, right? The problem happens is when they become surplus and it causes bothersome symptoms in women. Some symptoms are like itchy, the vulva, just generally itchy down there. I'm not going to be graphic with the words, okay? And it's generally itchy. There's an odor. Sometimes the discharge is like light to watery. Classic discharge is like cutty, looks like cheese. Women will also report like swelling, pain, little cuts to the vulva right before the infection or during the infection. It is generally really itchy. The best way to find out if you have a vaginal itch that is caused by a yeast infection is through a test. And that will be done in a primary care provider's office, in urgent care, wherever it's easily accessible to you. Common causes of yeast infections are, but not limited to, the use of antimicrobials like antibiotics, people who are immunosuppressed, people who have had like previous yeast infections and like hygiene, not really cleaning up really well, like the underwear, not washing it off thoroughly after a phase of an infection. People who are diabetic also are at high risk for yeast infections because for the cause of their disease, they're peeing out lots of like sugar through the urine, and sugar kind of it's a good breeding ground for bacteria like Candida and fungus, right? So take home message: proper hygiene. Try to stay away from diabetes if you can. If you do have a yeast infection, go get tested, get treated. And when you're treated, make sure that you clean your underwear really well. If you can change it, that's great. That way you're not like reinfected. Try to keep the area clean and dry. Don't stay in wet underwear or wet bathing suits for long periods of time because that just breeds more fungi. Also, try to ask if you have any questions, right? If you have any concerns, just check in with your primary care provider. Some people say eating like yogurts help. Bigger messages: if you're on an antibiotic to treat whatever infection it is, it helps if you take a probiotic with it, right? It just keeps you from getting a yeast infection that results from antibiotic use. That's all I can think about for right now about the yeast infections. Again, if you have any questions, please feel free to ask. I'm always available to answer. Thank you for watching.